This meeting is officially called to order. This is the Health, Environmental, Aging, and Disabilities Committee for October 22nd, 2025. I am the chair, Councilman Kobe Owens, for the 1st District. At this time, I will call the roll for those members of the committee first. Councilwoman Christian Wilhauer,
Here.
Councilwoman Maria Cabrera, Councilman Nathan Field,
Present.
Councilman Ala Tackett, and Council President Trippy Congo, and myself present. Councilman Hackett asked to be excused for this meeting, and so did Councilwoman Cabrera. She may be joining later. As a friendly reminder, only members of the committee are able to make motions and seconding. I would also like to recognize our council colleague at large, Councilwoman Letitia Tish Bracey, who is joining us here today. With that, we'll proceed to the agenda. We have a resolution and an ordinance to deal with first, and then we have a presentation by Christiana and by Shaleen from Wilmington City Council, policy fellow for Wilmington's energy future. So first is a resolution establishing a homeless subcommittee under the Health, Environmental, Aging, and Disabilities Standing Committee, and this is being presented by myself. In 2025, we've seen, well, before I get started, I would like to recognize Councilwoman Maria Cabrera, who has joined the meeting.
Thank you.
You're welcome. In 2025, we've seen a lot of efforts to try to better coordinate what is going on in our city when it comes to our unhoused population. There was recently a task force that just wrapped up work, but we all understand that the work here in this city will not end just there. So we wanted to, under this committee, we wanted to be able to keep some of that work going, piggybacking off the recommendations and the work of the homeless task force that Mayor Carney put forth, and those recommendations that were put forth as well too. So this establishes a subcommittee to continue to work with making additional recommendations 180 days after their first meeting, and then a full committee report after 12 months of the first meeting, again outlining any additional policy recommendations for the Wilmington City Council to look at. At this time, I will take any questions from council members. Councilwoman Wilhauer.
Thank you, Chair Owens. I just want to say thank you for bringing this forward. I think that these kinds of focused efforts on particular topics are really useful. I was part of the when Councilwoman Rashima Dixon established a subcommittee of the Community Development Committee a few years ago. It was really effective in bringing together people from a lot of different viewpoints on what needed to be done to address housing in the city of Wilmington. And there was a lot of great recommendations, some of which have been implemented by council, not necessarily right away, but over time. It was just a great think tank. And I'm hoping that this also can bring together people who've been impacted by the issue, people who are working with people who are impacted by the issues of homelessness. And I really want to say thank you for putting this together. And, I want to support it and do whatever I can to make sure it's successful.
Thank you for that. And again, this comes after many months of working with the mayor's task force as well too. Councilwoman Bracey was also a member with myself on this. So again, as we look at compassionate policy on addressing the unhoused community, while also making sure that we're lifting up all communities here in the city of Wilmington, this is why this subcommittee wanted to come forward. Councilwoman Cabrera.
Yes, Mr. Chair, if you or Councilmember Bracey, could you maybe give us some highlights of what came out of that working group? I have not seen the final report yet, but is there anything that stands out to you that are actions that we can take either immediately or as we move forward to get in the works? Like you said, a lot of things we may not be able to accomplish right away, but it's a work in progress that then comes out with some positive outcomes as we try to make changes and be inclusive of everyone in the community and address this issue, which we all know is facing everyone nationwide, aside from the affordable housing that is being built. I think that Delaware has been very assertive in that sense. I'm on the board of Sacred Heart, and I know that we just landed another project. Villa Maria is under works, and all our places are at capacity with a wait list. The need is there. And I'm glad to see that there is further development. This Thursday, there's going to be some affordable housing ribbon cutting as well on the east side, but there's more that needs to be done. So is there anything that stands out in this report that, or things that we can start working on right away or that we should be aware of?
So off the top of my head, and Councilwoman Bracy can jump in. One of the recommendations was to look at our zoning for affordable housing here in the city of Wilmington. Again, that can look like a vastly different depending who you're talking to or what that zoning needs to be and what type of housing we need here in order to address this crisis that we're going in. But I think we can all agree that we are in a extreme shortage of housing, of beds, and of resources for those who are truly in need and those who are facing being unhoused right now. I think one of the other areas that really was highlighted was what is going to be done with Christina Park right now. With in the recommendations, they recommended that be a temporary tent city there. While giving that okay to that, I think that we need more stable housing and better protections for them. There's been multiple different models out there that has done this. They included some micro housing, tiny homes recommendations as well too. Again, looking at that, the task force main focus was based towards actions that the administration can take because it was the mayor's task force. This subcommittee would build on that, but then look more at what are the policies that we as a city can do to really help move this forward going in the long run as well too, to address some of these issues. Councilwoman Bracy.
Thanks, Mr. Chair. I just wanted to add to what the councilman said for Councilwoman Cabrera and everyone. Going back to Christina Park, the purpose of when he mentioned the kind of the tent village, or well, actually the pallet homes, but currently there are already homeless that are encamped at Christina Park. So one of the things that I think came up quite a bit was if they're there, then we should be providing services, we should be providing food, and we should be cleaning the park. Other concerns were making sure that they have access to restrooms, making sure that there's a way for them to, there's mobile units that can come down so people can take showers. So while we're trying to identify the pallet homes, and we met with the folks from Georgetown who already have one established, this could be, let's at least provide services to the folks that are already there. So that's one of the things that I think we really should be looking at, what services that we're providing folks that are outside right now, as we also look at how we get them inside. The other thing that came up in the recommendations was repurposing the old Wilmington Housing Authority building and creating a day center. And so I know that's on the recommendations, and I think that's something that the administration and city council can really take seriously and look at. How do we create that day center so there is a place for folks to go inside during the day? Some of the other recommendations were creating lockers, because we know that a lot of the encampments, people have their belongings, and that's all they have in the world. And if they leave it and there's a sweep, or if they leave it and someone steals it, that's it. That's all their stuff. So how do we create some safe places where people can store their items? Of course, at the end of the day, we really need to be looking at how do we prevent homelessness, and how do we also address the housing shortage, the affordable housing shortage. But while we're, that wasn't the focus of this task force. The task force was mandated to look at how do we make it address the folks that are already outside. So I do think, Councilwoman Cabrera, there's a lot of conversation that needs to be had, especially as we're getting ready to get into the winter months. So we really need to look at what the recommendations are, what the administration wants to move on, and what council can move on quickly so that we can start putting some things in place before the holidays. Thank you.
Thank you.
Thank you both for the answers, and I'm sure that our public appreciates that. And I agree there's still more to be done. And how do we face the immediate concern now while we still work on long-term solutions? But a lot of those ideas sound good, and looking forward to working together with my colleagues, the administration, and the community in trying to find solutions. Thank you.
Any other council members? If not, I'll go to public comment. Will any members of the public please state your name? And if you're online, use the raise hand feature.
Hi, my name is Cheyenne Miller, and I'd like to give public comment in support of this resolution. I'm with Homes Campaign, and I don't know, sometime in the beginning of the year, I want to say, we sent a letter to both City Council and to the mayor asking for a subcommittee to be created, specifically in collaboration with the mayor and his office and the departments that would be necessary to address the issue of homelessness. And so seeing that this is moving forward today is like super exciting for us, because we know that that means there's going to be a focus on the solutions. Given that there's only like 14 organizations in the county that are servicing people in terms of homelessness shelters, we just don't have enough. Like there's like more than enough people, not enough beds. So I actually went to the Housing Alliance and I asked them to give us data from their latest point in time count. They go out and they like literally walk around and count the number of people who are living out in the streets and those who are living in shelters. They also take account of the number of programs that are servicing people and the organizations that are operating those different programs. They found that there were only 908 year-round beds in Newcastle County, but there were at least 962 people that they found that needed help. And so the numbers are showing that even if people wanted to get help, there simply aren't enough beds for everyone. And for those who have actually tried to call 833 Find Bed and have gotten into a shelter, you probably know that your stay is limited. You have about a 30, maybe 45, maybe even 60-day stay. But after that, you're on your own. You have to find a place to go. I think it's important that the commission or the resolution that's establishing this new subcommittee specifically focuses on the recommendations that are not criminalizing people experiencing homelessness, which was a commitment in the report that the task force came out with. Our concern is also making sure that the city continues to like provide funding and land and other resources that increase the number of shelter beds. It is not, no one's going to argue against the sanctioning of an encampment. However, people are not asking for public land to be allowed to camp on. People want housing. They want to see people go into shelters, and there are not enough shelters. There are not enough beds for the people who need them. So I just think it's important that when we are talking about doing a resolution to have a commission, that part of the purpose of that commission needs to be about increasing the number of shelter beds that the city has and making sure that people have access to those shelters. Another recommendation that came out of a different group of organizations that were hoping to address this were the fact that the city could establish a city-run homelessness services office, and that the city should make sure that they're prioritizing health and hygiene across all areas of the city, not just the parks that are in the downtown areas that they want to gentrify. Thank you for taking the time to listen.
Thank you. Would anyone else like to give public comment? Seeing none, seeing that this is a resolution, it does not have to be voted out of the committee. It will be placed on the next agenda, which I believe is November the 6th. All right. Next is a ordinance amending Chapter 2 of the City Code to repeal the defunct Wilmington Advisory Commission on Youth and Their Families to establish the Wilmington Youth Advisory Council under the auspice of City Council. The sponsor is Councilwoman Bracy.
Thank you. Thank you. So my colleague, Councilman Owens, is also a sponsor of this, and we're hoping to get other council members to support. I think Councilwoman Cabrera mentioned her support of what we're trying to do. So essentially, In 1994, City Council passed legislation that created the Wilmington Advisory Commission on Youth and Their Families. And then there was also a Youth Leadership Commission that was under the Department of Parks and Recreation. Over the course of several years, and this predates our current Director of Parks and Recreation, there were different iterations of the Youth Leadership Commission, and then it kind of just fell off by the wayside. I think some of that is, because of COVID-related issues, and then it just never got back on track. Simultaneously, the Department of Parks and Rec received a 5-year grant through the Department of Justice to do a youth leadership incubator program called YLIP. YLIP has been very successful, and that continues today, pending funding for funding extensions. So when we started having these conversations with Parks and Rec and with the administration about what we should be doing around youth, one of the other things that Councilman Owens and I and some other members of the Education Committee recognize is that for at least 5 years, part of Wilmington's strategic plan has been to have a youth master plan. It's been a part of the strategic plan since our former council president, Hanifa Shabazz. It was started, and then that also kind of never took off. So we really spent some time meeting with Parks and Rec, meeting with the administration, actually going out and talking to some of the participants in the YLIP program, really just to kind of get an understanding of what's happening now and how we could use the youth to help build that master plan. Our fellows have done a great job of doing a lot of research around this and looking at what other cities have done as far as addressing, like creating a youth master plan. And when we say that, the youth master plan would encompass policies that directly affect youth and their families, then also looking at what, from a city standpoint, we can be doing to increase activities and to address the concerns of our youth and not assume we know what they want, but actually get them involved in the process of telling council members what they want. Councilman Owens can tell you, and Director Phillips was at that meeting, when we met with, was about 20 youth. Yeah. Within about 10 minutes, we had a list of 20 things. And they were things we weren't prepared, like we didn't think that they were going to talk about. They talked about the parks being clean. They talked about the fact that if they miss their school bus, depending on what neighborhood they live in, they may or may not want to walk to school because walking to school isn't safe. And it's not just because of substance abuse or other things, but there might be some kid that lives in another neighborhood that doesn't like them. So there's all of these nuances that they're experiencing before they even get to school. So they made it very clear, you want to talk about education, but before I even got to school, I had to get my brother and sister dressed. I had to feed everybody because my mom went to work. I had to do so there was all of these conversations that came up with those youth in a matter of 45 minutes or so. And so that really struck a nerve with us to say that we really need to do this. So the idea would be, with this ordinance, is to create this youth leadership council that will meet for 6 months with council, with the Department of Parks and Rec, with members of the administration, and really hear from them to develop what that youth master plan looks like and what pieces can be implemented by Parks and Rec. What can city council do? Are there policies that need to change? So that's the whole purpose of this, is for us to really spend, I think we'll be meeting with them twice a month to work with them. The Department of, our Office of Education Advocacy is going to help oversee this. We're going to have fellows involved in this. So it's a holistic approach to really looking at hearing from our youth in a very strategic way, but also putting an endpoint on it so that at the end of, so that while we're going through the budget cycle, if there are things that we need to change, we're able to do that as well. So we try to be very intentional about how we created this program so that it starts and there's an end, and then we come out with a finished product that we can actually implement. So hopefully, if you have anything else to.
I think you covered everything. I know Councilwoman Cabrera has her hand up. I just wanted to add, I want to thank you for allowing me to work with you on this. And also, we want to hear from kids from all over the city. of Wilmington, from the ages or from grade 8 to grade 12, but also from all 8 of the council districts. We want to make sure that is a point in this because they all live different lives, and we want to make sure all their perspectives are reflected in this. So hopefully our council colleagues will support us on this. I will go to Councilwoman Cabrera.
Yes, thank you, Mr. Chair, and thank you, Councilwoman Bracy, for a very thorough recap of the reasons why we're doing this. I was actually quite surprised that we weren't continuing to do that youth council because I was on city council during the time that the youth council was in effect, and they came to meetings and brought suggestions forth to the council members. I am want to be a co-sponsor of the legislation, so if you can please put me down as that. And I recently shared with council member Bracy in the meeting last Thursday how one of the members of the youth council who I ended up mentoring through the course of the youth council, we met and we stayed in touch through the end of her high school career, college. She now works as a counselor, mental health counselor. Turns out my neighbor is her supervisor, but she recently invited me to her wedding that took place in September. And I was just so touched that for whatever reason, I made an impact that she has stayed in touch with me. And here she is out here helping the community as a mental health counselor. So these things that our students do, it does impact them. It does, the people they come across, it inspires them, and it is life changing and transformative. So I'm really looking forward to working with both of you in doing this. And who knows, maybe we can get that young lady involved to give back now that she's moved on and share her experiences with the youth council. So thank you both for doing this, and I'm looking forward to working on this project.
Councilwoman Will Heller.
Thank you, Mr. Chair. Councilwoman Bracy and Councilman Owens, I think this is a really great piece of legislation, and it's exciting to see how it builds on the work of the Department of Parks and Recreation with that 5-year grant and the leadership, the youth leadership program that they built. And so I just think there's a great foundation for doing this work. And I'm excited to see young people involved because they do have really good ideas, especially about what they care about. And the only question I have, and I was wondering if you might take this as a suggestion, is I do think there's a need for the Wilmington Youth Leadership Commission, and I'm not sure it's necessary to just eliminate it. You know, you could leave it in the code so that if there was an opportunity when all those different entities wanted to coordinate activities, they would have a structure to do it. So that's just a suggestion, is that let's establish the Wilmington Youth Advisory Council, but let's let the Wilmington Early Care and Education Council continue to exist just in case it's needed. And I do think there's a need for it. I think it would be really important to, I was reading through all the different groups that were supposed to be coming together, and I think there is a need for it. So anyway, that's just a suggestion.
Just real quick to clarify, you're saying under section 2-131, you would want part B to stay, which is establishing the Wilmington Early Care and Education Council to foster collaboration between existing programs. That part.
Yes, identify gaps in current service delivery. Yes, all of that. It'd be great if that stayed.
So, I do,
Yeah, go ahead.
Actually, two things. One, I do want to recognize that Director Phillips is on, and if she wants to chime in at some point. One of the things that when we talk to Director Phillips, we do not want to, we don't want to impose on the current WILET program, which is a much more robust undertaking. And so we are talking about, like, how do we keep funding that as the ongoing city program? So there may be a circumstance where, and Director Phillips may want to chime in on, if we kept, so that would be under Parks and Rec. So maybe it is a situation where the commission, because the commission, I think, falls under Parks and Rec. So then our piece would still fall under city council, but if we don't strike that down, the overall process would still fall under Parks and Rec. Director Phillips, am I correct?
So good afternoon, everyone. Director Dr. Melody Phillips here for Parks and Recreation. So yes, but I guess my question is, currently you're correct in the code, the Youth Leadership Commission is under the Parks and Recreation Department. What we would need to know is if City Council's ordinance is what we thought is moving the Youth Leadership Commission under City Council, which is fine if that is something that wants to be done, or is City Council requesting that Youth Leadership Commission become active again in the way it is written now, because it's currently, as someone else mentioned, defunct, right? It's not actively involved. This past summer, our Wilmington Youth Leadership Incubator Program, which is the grant that was funded by the Criminal Justice Council, they did a small group. They met with Councilman Owens and Councilwoman Bracy to kind of give information about what young people see, what affects them before they go to school, everything that was mentioned. But that program, specifically Incubator, is now on hold because of the government shutdown. So we are not have not been able to do anything further with the program right now. We were anticipating it being extended through at least the end of January, but when the government shut down, the federal government informed Delaware Criminal Justice Council that program had to go on hold. So those youth are currently not working. They're still actively participating in the community centers that they are members of, but they're not working. So what Parks and Recreation would need to understand is, if it's moving under City Council and you're just asking for parks guidance or, background support, that I don't see that as an issue. But if it is something where it's supposed to be the actual ordinance and the rules live under Parks and Recreation like it's now, and that we're no longer going to have it defunct, and that it connects to the Youth Master Plan, then that's something that needs further discussion. And of course, I would have to meet with my supervisor, Deputy Chief of Staff Walker, to see if that's something that we want to actively bring back and if we have the manpower to do it. So you're right. I was going to chime in and at least ask that question.
Thank you, Director Phillips. Councilwoman Bracy.
So the way our ordinance is written, as it stands right now, we were eliminating the Youth Leadership Commission and the two defunct programs right now, the Early Care and Education Council. We were just eliminating those, and we were creating the 6-month plan for the Youth Master Plan. So that's what falls under City Council, would be just that Youth Master Plan. Anything outside of that would still be Parks and Rec. But the way this is written now, these two they're defunct. So we were just getting them out of the code because they don't exist right as it stands right now. That's if we wanted to, as Councilwoman Willauer is suggesting, keep it in the code so that if we want to have those conversations about bringing it back in the future, I'm open to that. But we were just cleaning up the code because they're not doing anything. They're not moving anyway.
Thank you.
Okay, thank you. That's helpful. Oh, sorry, Councilman Owens. Thank you.
You're good. I would also like to add, so the Wilmington Early Care and Education Council, one of their features was to find grant funding, both from federal, state, local, and private dollars in their own name, and then it was administered by, I guess it would have still been under Parks and Rec, the mayor's administration. I would be in support of bringing this back in a more up-to-date feature where that's not their primary focus, but their primary focus is kind of streamlining that gap of services for individuals. But I think that would probably have to be a standalone piece of an ordinance to bring this back and take it outside of parks and just make it an advisory committee, very similar to other advisory committees that we have. With that,
sorry to interrupt. Mr. Chair, may I just make a comment?
yes.
I
Please introduce yourself.
My name is Dr. Kendra Brumfield-Nwangna. I'm the Legislative Research and Policy Director for City Council. I would check and get back to you, maybe circle back on the WCAC, because it's my understanding that WCAC does have meetings, that is, the early education part is something that still happens. But I will double check on the ordinance and circle back to council members with more information about what the arrangement will be with this. Is that okay? I just don't want to speak prematurely, but I do know that there is a early education group, and I don't think it's going to be, eliminated in terms of their function based on this ordinance.
Deputy Chief of Staff Walker.
Thanks, Chairman Owens. I just wanted to clarify, I think Dr. Kendra was speaking to it. The group, sorry, those who don't know, Daniel Walker, Deputy Chief of Staff to Mayor Carney. The WECEC group, which is the Wilmington Early Care and Education, that was initiated in City Code, but that group has since become separate from City Code. They do exist. A matter of fact, they get funding annually. A grant is given from the city to that organization. And so it does exist, but it was incubated in City Code. It is defunct in terms of on our book. That's something Parks oversees. It now lives on its own.
So this would be okay to go ahead and to strike out this language here.
I do not believe their existence is dependent on the language in the code.
I see Ms. Marshall Bassnight, Senior Advisor to the City Council. Yeah. And also I would like to recognize Council President Trippy Congo has joined.
Yeah, Mr. Chair,
we can barely hear you, Ms. Marshall.
Let me turn up my volume.
There we go.
Yeah, so just to add on, City Council provides an annual grant of $15,000 to WECEC, and that language that's in the ordinance that's been deleted is not predicated on that. And the funds that we do disperse does go to Parks and Recreation Department on behalf of WECEC.
Thank you for that. Director Phillips, I see your hands up. Is that old?
No, it was pretty much to agree with Ms. Bassnight and Deputy Chief of Staff Walker. Yes, Parks is overseeing it. They are a full working group, and that they receive funding. They are paid. We process their timesheets, so they definitely exist.
I think it's an open question.
All right. Is there any more questions from members of council? If not, I will open it up to members of the public. If you're online, use the raise hand feature. All right, seeing none, this is a ordinance, but it does not have to be voted out of committee, and will be on the November 6th agenda. Next, we have a presentation from Christiana Care about their community health outreach. If you both would like to join us and introduce yourself. And again, I am happy to have y'all here to talk about the work you're doing in the community. If just real quick before we start, Monday morning, I lost a dear friend of mine who was only 36 years old due to some health issues. So again, trying to highlight what is available to our community is going to be a personal mission of mine over these next few months to really get the word out there. And I know so many of us have lost loved ones and friends due to us not engaging and taking care of ourselves properly. So I look forward to hearing your discussion about the ongoing work y'all are doing and how council can be potential partners in that work. So please feel free to introduce yourself and we can go from there.
Thank you. Can you hear me? Well, first, I'm sorry, Mr. Owens, about your friend. I am Dr. Leroy Hicks. I am the president of Wilmington's campus for Christiana Care. And with me?
I am Dr. Emmanuel Mensah. I am an internal medicine physician and also the chief medical officer of the Wilmington campus. And my condolences as well.
Time precludes me from maybe going into tremendous depth on the background of many of the initiatives, but I will, understanding there's a question and answer session, be happy to answer any questions about that. Why don't I launch into 4 new initiatives, brand new, that we're bringing, one of which is sort of bringing back to bear things that we had attempted in the past. And we can talk in the question and answer session about how we may benefit from a community engagement to help make sure we reach the people we intend to reach. So I'll start with the first 2 initiatives. We're really focusing on improving women's health and access to specialty care in the city of Wilmington. A little bit of data informed both from our community advisory committees about the needs, as well as from data from needs assessments and geospatial coding have shown us a few things. The first, despite being a very small state, we're among the national leaders in triple-negative breast cancer mortality among Black women. We also are among national leaders, despite our small size, in the prevalence of advanced stage breast cancer among Black women and the disparity between Black and white women. It's an enormous issue. Over the last 2 years, we've really focused on increasing mammography rates in the city of Wilmington. And last year actually took a pause because the demand for the number of screening tests we had to do outpaced the availability of radiologists to read the tests. That's how big a need we were actually meeting. Now, over the past year, we've actually been able to staff up on the clinical side, the people that could read the test. We also last year lost a breast surgeon who was in our community, who you need a breast surgeon actually once you have findings to help do biopsies and then obviously for treatment subsequently. I am proud to say and happy to say we've been able to successfully recruit 2, both who will have a focus actually on practicing and operating on Wilmington's campus. One has just arrived and the other one, my understanding, will be here by the winter. So a couple of things we're doing. One, we're beginning right now to strategize about buying an additional mammogram machine, actually. 2, we've engaged not only with our wonderful community advocates who are linked to the Helen F. Graham Cancer Center, who have been active in many of the fairs you've seen around the city, many of the community events, but also language services, because there's a disproportionate increase also among Spanish-speaking women in our community, and we hold days specifically for non-English-speaking community members to help facilitate better screening. So that program is not only increasing in terms of its robustness, we want to bring more of it here in terms of our resources, and I can touch more on that. The second program is brand new. So succinctly as I can, fibroid disease, uterine fibroid disease as we refer to it, in the U.S. is a scourge, particularly in the Black community. So if you look at the data, in the U.S., Black women in the U.S. have 3 times a greater risk of being debilitated from uterine fibroid disease than whites. We have among the highest rates in the U.S., and we have a disproportionate burden, not surprisingly, in Wilmington compared to other areas. Yet, there have been no robust program to treat and care for women with uterine fibroid disease with the goal of preventing hysterectomies. And so we've been fortunate that Dr. Monique Farrow, who is an obstetrician gynecologist who specializes in what we call minimal invasive gynecologic surgery, the goal being minimally invasive, is coming to us from UPenn, and in fact, she is now here from University of Pennsylvania. It's our intent to actually have her at Wilmington Hospital, so she'll be within our gynecology department, Wilmington Hospital based, performing minimally invasive, we call them MIG surgeries, at the Wilmington campus. So I asked members to parking lot that as we think about the engagement of the community, because what we have found is that there's such an enormous need. We build a structure and we understate or underestimate the impact or the importance of getting the people to the resources that are available, right? Okay, and this is obviously a tremendous need we want to make. The third program focuses on vascular disease. If there is a resident in Wilmington who has not had an amputation, I guarantee you they know someone who has or are 2 degrees separated from them. What we have found through many of our analyses is that our rates of people by amputation, I mean losing a limb, could be a foot, could be below the knee, could be above the knee. Our rates of amputation for people who have never had an intervention to prevent it come into the emergency room and at initial diagnosis then get an amputation are among the top 10% in the country. Okay, focus at Christiana Care. It's an enormous issue. And many, many data points have shown that this is an issue of health disparity, quite frankly, lack of access to the care that's necessary to prevent this. So we are actually right now planning a limb rescue program that we want specifically housed at Wilmington's campus with partnership on the Newark campus as well, because there are some advanced services that will require people to be seen there at Newark. So the goal is to increase screening, diagnosis, do some preventative procedures at Wilmington's campus, and then facilitate care on Newark's side for those things that require more intensive resources that exist surgically in that space that we can't right now build at Wilmington's hospital. I'll add one more data point that's important to understand. The need for just screening for this disease. We've recently analyzed more than 2,000 people that live in Newcastle County who are either Medicaid or Medicare and are assigned to Christiana Care, right? Disproportionately, those Newcastle County residents live in Wilmington. Fewer than all of these 2,000 would be eligible for the initial screen, something we call an ankle brachial index, ABI testing. Fewer than 5% of the people who should have had this test have had it done in the past year. That is an enormous problem. So that's where we're beginning to start. Right now we're planning to massively screen. We have contact information for the patients because of their contracted relationships and sort of building a program from there. Happy to answer more questions on that. I think last, which is critically important and something that the community going back 4 or 5 years really asked for, is really being more strategic about access for 2 things related to primary care. One, access for more urgent care when needed, same-day access for patients, because it can be difficult for patients to get into their primary care doctor when they actually have one. The second thing that has become an increasing need is specialty care and focus on something we call cardiovascular kidney metabolic syndrome, right? Which is the spectrum of diabetes, obesity, kidney disease, mild renal insufficiency, hypertension, and a little bit of heart disease. So we have actually initiated a program, a clinic, that is starting on the Wilmington campus with 2 doctors, one of whom is focused on high-risk patients who have been seen in our practices but have resistant hypertension and complex disease and aren't seen with the intensity necessary to get their disease better controlled. That program is now starting, and that doctor takes that panel of complex patients that frequently end up in our emergency room and also has open scheduling available for people to come in the same day, which is a major undertaking, okay, to prevent them from utilizing the emergency room unnecessarily. The second thing we've done, which has been a real issue in the city, was increase the presence of cardiologists to focus on these other complex syndromes related to heart disease. Dr. Zach Hermes, African-American cardiologist we just recruited from Boston, has now arrived. His practice also at Wilmington campus. Again, the focus is on the city. And I hope I've provided clarity and I've sort of responded as requested, and I'll stop there.
And if I may add two things. One is Dr. Hicks spoke about the.
Introduce yourself.
Oh, my name is Dr. Emmanuel Mensah, Chief Medical Officer at the Wilmington campus. Dr. Hicks, two things to add. Dr. Hicks talked about the limb rescue program. We actually have recruited Dr. Vikas, who is a cardiologist, actually trained in New Haven at Yale, to really come here and focus on this peripheral arterial disease or poor blood flow to the legs. The second thing we've been doing is really going out into the community, different events to try to let people know that we have these resources. Dr. Vikas himself spent a whole day with me at August Quarterly recently, trying to engage the community. Same thing, he showed up at Health, Hope and Hip Hop as well. So we're really trying to go to different outreach programs. But I think the second point is what Dr. Hicks said. We need your help to make sure that the resources you are providing, the community is aware of it. Because often we have a mindset of if you build it, they will come. But sometimes there's that mismatch and that gap. And that's why we need the help of this committee to really reach the community on all the things we are trying to provide. Thank you.
Thank you for that. I will open it up for questions from council members. Do any council members have questions?
I just want to say thank you for coming in and for explaining your programs. Those programs, I know also, I believe Christiana Care has a social worker program that works with Medicare patients. And I think that that kind of program is really important, especially for people who are more isolated and need someone to coordinate their care. So I hope that also is, I'd just love to hear if you have anything you want to talk about that, just so people can hear more about that program.
Thank you for that. So there are a couple of different, when you say social work, there are a couple of different roles within our organization that may fit that description. I will say that they are engaged, both of the roles that I'm thinking about, and our processes there. So we have community-based sort of navigators that work with and health advocates that work with identifying populations, the barriers that they have to getting things like their medications and appointments, and then they are linked to our healthcare system, community health worker model, to help meet those needs. So the people who are responsible for that program are actually being invited to participate in each of these programs. More specifically, coming to the limb rescue program, they're already engaged in the breast cancer program. So that's very, very important. The other thing is that in the heart and vascular space, we're working on an ambassador program, which isn't just people who haven't had any structure or formal training or engagement with health system, right? It's more people who have had a history of being connected and understand sort of how to translate what is available to be delivered and meet the needs of the people who have the request. And so they're also going to be engaged in a lot of the planning. We're trying to bring in that diversity of skill sets that are necessary that we already have into the planning from the very beginning, as opposed to trying to catch up if we fall behind.
Thank you. That's all I have, Mr. Chair.
Kind of piggybacking off of the community engagement and highlighting some of the programs. I know some of these, you really don't hear people encouraged to get screenings and stuff until a certain age. Have you done any outreach, piggybacking off of what we talked about earlier with the youth council? Have you talked to any of the community centers about engaging with their youth, about at least bringing this to the forefront of their minds now? They may not be old enough to get tested, but at least, having the conversation about the different diseases that our community is facing, and what they should be on the lookout for as they start to get older.
I'll let you comment about your experiences. I will say, frankly, less engagement with the youth and more engagement with the adults. I actually think that's a great opportunity that you mentioned, right? As some of you are aware, we are frequently invited to speak to audiences, right? Men in the city or churches or varying functions. But I have not participated in or driven a direct conversation about engaging with youth on this. I like that idea.
Yeah, I agree with Dr. Hicks. I think we haven't really been engaged with the youth as much. More in a school-based system is where our engagement lies, but not as robust as we engage with adult groups. I mentioned August Quarterly, churches that we go to, etc. So that's definitely an opportunity.
Councilwoman Bracy.
Thank you. Thank you for coming to speak with us and sharing and shedding a light on all of the amazing work that you're doing at Wilmington campus. Are there or is there information that you can share with our office that we can start to disseminate for you? Like, is there, you mentioned, us being a vehicle to help you get information out in the community, and I think as much as we can, if there are things that we can be sharing when we're at civic association meetings, or if there's, information our social media team can be posting about, it's Heart Health Month or this, that, and all of the things, so that we can start to integrate that into our communications. I think that would be helpful as well, because, there is, working with certain populations, they don't trust doctors. And so trying to do what we can to kind of break that stigma to say, no, you need to go. And it's convenient. You don't have to take the bus to Newark. You can just go right up the street. So whatever we can be doing to help get that narrative out, I think, we're willing to support.
Thank you very much. So we'll take note. There are two. One is very well formed, and there are many materials we can share, and that's obviously related to mammography screening and the work that we need to do locally with breast cancer. The second one, which has already begun and doing promotional materials about the physicians, is related to that higher risk primary care practice. Some of that we're building, and as we build it, we'll certainly be happy to bring it to you. And these other two programs, fibroid and limb rescue, we will keep this top of mind as those programs further develop.
But even in the short term, items like we have a cold and flu line, for example. Last winter, we got quite destroyed with so many patients coming into the emergency room when we had other outpatient resources and other avenues to get care. So something like the cold and flu line that we have created, that's something that we will need your help to disseminate to the community so they don't show up in the ED. And we can preserve the ED for those high-risk patients who are truly sick. So that's a quick example.
That's excellent. And we all thank you for mentioning that. And there are other things we haven't touched on that are existing programs, and like the cold and flu line, our community just isn't as aware of them, right? Which we can advertise. Headache clinics, for instance. Some of the our stroke program. Our rehabilitation and outpatient rehabilitation program for physical rehabilitation after injury or harm. So a lot of those things we could actually be much better about connecting with, and I think have good materials that might be of benefit.
Quick question, and I'll do another round for other council members. Wilmington is going to be greatly impacted by the cuts that we're seeing to Medicaid, Medicare, SNAP, all of it, right? I know y'all have a pharmacy program with the Lutheran Community Center. When it comes to services like that, and people are losing their coverage and everything, what programs do you offer that have maybe a free benefit to the community? Is it additional screenings? Is it, I know during the pandemic years, we had the Bridge Access Program, which helped people get COVID shots who were underinsured or had no insurance. Is there any programs that y'all have currently that operate in the city of Wilmington? And if so, what are they, and are they going to expand with everything going on in this world?
Yeah, I'm not fully prepared to answer that because I'm ill-informed on all of the things that we're doing, but I can speak to a couple of things that we hope expand. And in fact, even this past month got a commitment to increase our availability to do this going into next year as well. So among the most expensive things, and this may be surprising, is orthopedic care. And if you, again, live in the city and you think about the demographics of the city, you recognize that far few people in Wilmington who need surgery for their joints, their knees, and their hips, or even care through our musculoskeletal program, are able to get it. In the traditional model, if you are poor, right, and we know that's collinear with race in many cities, you just don't get the care. And so our centers of excellence are often filled by people who live in, say, zip code 19807, and not from 19801. We have really two programs that offer free of charge services for people who do not have insurance. One is through our musculoskeletal clinic for those patients who need diagnosis and treatment and assessment for surgery. The other is partnering with a national organization called Walk USA, where we're actually funding, I funded knee replacements and revision last year for patients who are uninsured, which is, not inexpensive. We are doing 2 surgeries this year, and we have a commitment to continue putting this in the budget for next year as well. So that's an example of something that's actually quite debilitating that we're doing. For the more general things, hypertension screening, access to our practices. We do most of that work, Mr. Owens, through community outreach. We are not aligned. We have a 340B pharmacy, which allows us to, which is I think what you're referring to, help administer some medications, particularly our hospital-centered ambulatory pharmacies at lower cost or no cost. But to be honest with you, when you're talking about people churning off of Medicaid and not being able to go on as those numbers increase, I am not aware of how we're planning to expand those services yet. So I can come back to the committee once I get more information.
Thank you for that. Councilwoman Cabrera.
Thank you. Piggybacking on that question that Councilmember Owens made, as an insurance agent, I am seeing firsthand that depending on the outcome of this government shutdown and the additional cost share reductions for the affordable care, plus the cuts to Medicaid, they're going back to the previous numbers of eligibility. So you're not going to have those post-COVID eligibility of 8.56% of a person's income.
Yeah.
So now what is being proposed by the Republicans is cutting back on the cost share reductions, which basically, in plain language to people who don't understand how this works, let me just share. That means that someone who comes off the rolls of Medicaid because they're making more money, they got a job, or because of the cutbacks, they're coming off of Medicaid, they're able to get a plan in the marketplace known as Obamacare. And normally, because they're under a certain percentage, 200% and under, they would get they would get additional monies and bring down the cost of the co-pays, deductibles, making the plans affordable. I'm telling you right now, because I've seen it, without those cost share reductions, these plans are going to become unaffordable, even with the regular tax credit for someone who is not making that much money coming off the Medicaid rolls, which means that you are the front line, the hospitals that are going to get hit with people using the emergency room as medical care, which is what we used to see before the Affordable Care 10 years ago. Where people still run to the emergency room instead of using their doctors and doing their preventative care. And that is my greatest fear, because the fact is that when people do have the insurance through the marketplace, and all insurance, they have to give you 100% of the preventative care without a cost to the person. That means that more people are not going to be getting the screenings. The women are not going to get their mammograms. And we already know that the minority community suffers from certain conditions because of lack of accessibility to medical care. I know that, breast cancer in Hispanic women, they have a less incident of getting it, but they have a higher breast cancer because they're not getting the preventative care. So if you take a community like that and others, prostate cancer and hypertension in the African American community, and people are not getting these screenings, we're going to see an influx of disease rising again in our communities, people dying because of these preventable measures and care that they could have gotten. And I think to Council Member Owens is like, how are the medical facilities, mainly the hospitals, because you're the front line, going to respond to this with everybody experiencing cutbacks?
Now that's the question of the year, and it's the question nationally. The truth is, Ms. Cabrera, that I am afraid, as are many of us that care about population health, about exactly what you mentioned, right? Which is an overwhelming census of people who come in with much more advanced disease because they couldn't get preventative care. What Christiana Care has done in advance, as we saw these steering winds over the course of last winter coming, is from a, what can I share publicly? When we think about how we build our programs and we think about the budget, one of the things that we have to do is we have to forecast what happens if everything costs more to deliver because of tariffs, right? Or less regulation, let's say, in pharmaceutical costs. So everything costs more. And the people who we want to serve, we don't get reimbursed for, right? Because we're still going to give the service. So how can we work through our decision-making and strategies to achieve that balance? The only assurance that I can give you today without the details, because I don't want to misspeak, and I said I would bring some things back, is as follows, right? I do think that over this first 3 months, what we've seen is we've done a very good job with forecasting that, and that allows me to have the confidence to say we're going forward with building these programs as planned, right? With an expectation that there will be patients who are self-pay, quote unquote, in the program. That's one reason why I talked about already building things in the budget for joints for next year. But the degree to which we're going to be effective really depends on how many people lose their insurance and some of the other factors that you nicely articulated that are just impossible right now to completely predict in terms of their magnitude.
Thank you.
Is there any other questions from members of the council? I do have one more question just about 340B pharmacies. I know y'all operate one. Do y'all have any satellite sites outside of your campus, Wilmington campus, or is that the only pharmacy?
So it covers drug administration throughout the organization for Christiana Care. There are aspects of it that also kind of are related to getting drugs on the inpatient side and making sure that it's available to certain patient populations, as well as our outpatient clinics. I do not know of any freestanding Christiana Care. I do not know of, not to say it doesn't exist, freestanding Christiana Care outpatient pharmacy that is not attached to, say, the Newark campus or the Wilmington campus.
Okay. And this isn't directed to you, but a suggestion could be looking at some of these former Rite Aids that are now closing up. I know in my community, we have one right on North Market Street that closed down. I've been in talks with members of the community and hopefully starting those conversations with the state about how we can keep that as a health hub, at least, with that pharmacy being there, and then maybe bringing in a provider over there as well, too, especially in a neighborhood that needs it. My biggest thing is now that the next closest pharmacy would be either the Wilmington Hospital or they would have to go up 202 or Philadelphia Pike to one of the Walgreens or CVS's or whatsoever, Target, to get their medicine. So again, for the seniors who rely on the fact that this was literally right in their backyard, but then also just families, it's just easier to access when you have those type of resources in your community. And I know the 340B program has changed over the years due to some lawsuits and some policy changes. But seeing what we can do to work with that here and how maybe we could be a partner with making sure we have more reliable resources in our backyards, in our neighborhoods, in our districts. I will open it up to the public. Again, you have 3 minutes if you have any questions. And you can direct all questions towards me, and then if Dr. Hicks and his team can answer them, they will. Does any members of the public have any questions? If you're online, please use the raised hand feature. I do not see any. Again, I just want to say to Christiana Care, thank you so much for joining us here today. We look forward to having y'all back here, maybe in the new maybe in the new year. So again, thank you so much for being here, and we will move to our next presentation.
Thank you very much.
Thank you, guys.
Sorry about that. Sorry.
Next, we have a presentation on Wilmington's energy future. This is a state and local update by Shaleen, who is one of our City Council policy fellows. Yes, you can.
Mr. Chair, very quickly before you start.
Yes.
I will be on the meeting, but I do have to jump off to get into another meeting. So I'm just asking to be excused. I may be jumping off. I don't want to interrupt the presentation in the course of it if I have to jump off before it's over.
Okay, perfect. Thank you.
Thank you. Mhm.
Floor is all yours. Please introduce yourself.
So my name is Shaleen Munuhe. I'm a policy fellow with the Wilmington City Council. And on behalf of the research team, I would like to speak on the Wilmington energy future. And I'll be talking about the state and local updates that we've been seeing lately. So on the first slide, and the first picture is just a picture of Wilmington and how beautiful the landscape is. So on the first slide, we're going to talk about what's actually happening across Delaware. My second slide, please. So currently, Delaware imports 60% of our power, which means that 40% of our power actually is what we generate. And all the plants are currently retiring. Some of them are like the coal plants, and they're retiring faster than being replaced. So, and at the moment, data centers and AI are driving the annual rise in energy by 2%. So currently, the state, that's the legislature, they're working on efforts of expanding solar, wind, and battery storage. So that's what's currently happening within Delaware. But I would also want us to know that why are we here? Like, why are we even talking about energy at this point? So this whole conversation started because during the winter season, we've experienced a hike in Delmarva power bills. And at the first quarter of this year, we had PJM making a presentation at the House where they warned that there's a rising demand in electricity and possibly having shortfalls of supply in the next coming years. So the load growth is being driven by data centers and also EVs and economic expansion. And this is outpacing the new generation that is coming. Currently, electricity prices and capacity cost are increasing and obviously putting pressure on households and city budgets. Delaware and cities like Wilmington should try and strengthen their energy resilience. And this is maybe through rooftop solar. These are just resources that we can use, storage, efficiency, to secure our energy resilience. There has been an increased interest in energy diversification within the state, and there have been different meetings happening every month with the energy stakeholders, which we've obviously been attending as the research team. I would also want us to talk about some of the legislations that actually happened and were signed into law by the governor this year. There is the Senate Bill 59, which talks about the utility rates oversight reform, which talks about utilities can only recover costs from customers if they were reasonably and prudently incurred. So this is one of the bills that was passed this year. We also had Senate Bill 60, which talks about the utility cost recovery limits, which talks about preventing regulated utilities from passing cost to customers. And this are unrelated activities, could be lobbying, political campaigns, or donations. So this was also passed, meaning that Delmarva cannot actually pass this cost to customers through in the rates. So there's also the Senate Bill 61 on the transparency of PJM, which means that the Division of Public Advocate and Delmarva have to submit details on all the votes cast at PJM. The other bill which was passed was the Senate Bill 175, which is in the next slide, on net metering updates, which happens in the event that the customer has actually generated more than they have actually consumed, which means that if you have generated more, you can actually transfer your credits to the next year. So this only happens when you have, for example, you've used only, for example, you're using your credits, you've probably generated more, and what you're consuming in your household is less. So whatever you're gonna get be billed by Delmarva is the difference of that. So if continually you have more, it's gonna be passed to the next year, which wasn't there before. So this Senate bill is really important when you think about solar. There's also the Senate Bill 155, which is the substation permitting reform, which requires the permitting of an electric substation as a conditional use if it meets certain conditions. This obviously was because of the Sussex wind power plant, which was being proposed, and also the House Bill 50 on the Delaware Energy Fund assistance, which funds, which helps households earning who are in the 350% of the income level of the federal poverty level. So on the next slide, we're going to look at some of the policy shifts that have happened recently in Delaware. We had the recent Climate Action Plan comments, which were closed on October 10th. And some of the, just as a subtopic of that, there's a pending legislation on having a sitting commission, which is supposed to speed up processes of approving renewable energy projects. Another thing is also the Delaware State Energy Plan, which will provide a roadmap for implementing energy and emission goals. As well as the net metering legislation on carrying forward credits to the following year, which we talked about, and energy assistance for low-income households, which is likely to extend until next year. And then there's also been legislations for data centers, which is obviously being done by DENREC on land use, water use, noise, air quality. So these are things that may arise in case data centers eventually move to Delaware. And I think we're just trying to look at ways how we can overcome that in case that happens. I just want to talk a little bit about what PJM is, and I know I've been mentioning it before, and I just want to say that PJM stands for the Regional Interconnection, or a regional power grid operator. It manages flow of electricity in 13 states, including Washington, D.C., and ensures that power plants and utilities work together to keep the lights on. The states that are served are Delaware, Pennsylvania, Maryland, New Jersey, Ohio, Virginia, West Virginia, Indiana, Illinois, Kentucky, Michigan, North Carolina, and Tennessee. So if you look at the word PJM, it's actually Pennsylvania, New Jersey, and Maryland. Those were the first states that came together to form it. It coordinates, so PJM also coordinates how much energy is generated, transmitted, and used. It's like a traffic controller for electricity. So I put this, so the next slide, I put this picture just to illustrate how at this moment PJM has forecasted that there's probably going to be 30 to 32 gigawatts of energy load that's going to come by 2030. And this is by data centers. And so if you look at this map, this is basically regional interconnections for different places of the U.S., but our point of concern would be PJM and Florida. What I mean is, at the moment, PJM is actually facing a shortage in new generators to meet the demand. And if you look at Florida, which is obviously outpacing PJM, and Florida is just a state, it's going to be able to bring 18,000 18,000 megawatts to power its state, but PJM is only bringing 17,000. So the point is, PJM is actually having a shortage of new energy coming in, which is why I think it's a risk for Delaware. Delaware is currently a big importer of energy. 60% of our energy comes from importing. We only generate 40%. So, and PA, which is one of the states that actually exports energy to PJM, has been having a rise of data centers, and one data center could actually take 900 to 1,000 megawatts. And if this actually happens, there's a chance that they might actually pull out and try and source and power their data centers. So most of the generators will not be online because they will be powering their own data centers, which means this amount of energy that PJM has will probably go down, which is a risk for other states that are in the PJM interconnection. So the next slide is basically just talking about data centers and what it means for the US. So currently the US has there's over 5,400 data centers, which is 54% of the global share. Delaware's data demand is smaller, but it's growing. We currently have one data center which is being eyed in Delaware City. It's in Newcastle County. There's legislation going on about it and how they can manage on the permitting. So that's the current data center that is currently being eyed in Delaware. And currently the legislators are studying on tariffs or just ways for them to bring their own energy instead of consuming energy from the grid. For example, the data centers could probably come in and have their own community solar or their own microgrid to power their own, to power the data center instead of using energy that would have been used by residential customers. And the goal is to avoid, obviously, passing costs to residential customers. Why does this whole thing matter? Obviously, the rising cost of electricity, which was highlighted by PJM, supply risks for generation, and then there's pressure to require data centers to bring or finance their own generation, and possible rate impacts to residential customers. And just maybe to look at why data centers are a big thing right now is because some of the pros and cons is because they feel like data centers are, they could bring property tax to the city. So there's pros and cons for them. They could bring jobs. They could also bring jobs in electrical maintenance, construction jobs. They could also provide opportunities for people to sell infrastructure to them. So the downsides could be issues to do with water pollution, air pollution. There could be obviously a spike in energy demand. So there is pros and cons of data centers, but we also need to look at the bigger picture when you look about when you think about having data centers investing in Wilmington. So I also want to talk about some of the areas that Wilmington has been looking at, and I'll just start highlighting a little bit about solar power in Delaware, then we'll go to Wilmington. So currently there is 10,000 homes that are powered by solar and businesses. And then there's pending legislation on balcony solar. Balcony solar is the second picture down, where you have, which is probably the best way to actually have solar in Wilmington. There's currently permitting improvements underway to ensure that solar is becoming favorable to residential customers. And we think Wilmington can lead when you talk about public building of rooftop solar. Why is this? Recently, the beginning of this year, we had a project with NASA. Wilmington, DENREC engaged NASA to do a study on Wilmington, and they did a mapping of areas that could be suitable to have solar in Wilmington. And they did this during the summer when there was a lot of heat, and they could actually see where the hot spots. They were able to identify about 838 places that they could actually install the rooftop solar. And And so if you look at the mapping there, that's the spread. That's the next slide. That's the spread of where all those hotspots are. And this, so if you look at some of the areas that are mentioned or are highlighted in that GIS, I know it's really not, it's not very clear, but I'll just say that the North Market Street is one of the areas that was very high when it comes to hotspots. There was 47 places that were, 47 places that were mentioned could be potential places that we could have solar installed. And these are buildings which are commercial, residential, but most of them are actually commercial. Christiana Avenue had 24 places mentioned. North Union Street had 18 places mentioned. Pennsylvania Avenue had 17 mentioned. Delaware Avenue had 15 places mentioned. West W 4th Street had 14 places mentioned. A Street had 14 places mentioned. Lancaster Avenue had 14 places mentioned. North King Street had 13 places mentioned. North Broome Street had 13 places mentioned. So Market Street actually stands out as suggesting as the best solar potential area. There were two structure types that were actually used. They used, so if 83% of the places that were identified were commercial places, and then 17% were residential. Some of the addresses, if you go to the next slide, please. These are the top 20 addresses that we identified. Some of the zip codes that were actually frequently mentioned were 19801, 19802, 19805, 19806, 19809. So 19801 had 356 addresses actually. So just in summary, just to know that certain place, the Market North Street obviously was, as I mentioned, was among the top areas with the best solar potential. So if we move on to the next slide, and I actually have a list of the 838 addresses that they were able to come up with. The research team was able, they gave us locational coordinates, but we were able to get the coordinates with the research team. I want to talk about electric vehicles. Electric vehicles or transportation accounts for 30% of Delaware emissions. And it is important to note that currently electric vehicles can actually qualify for rebates for up to $2,500 for new vehicles. And they're available for residents, businesses, and cities. So this is information that could be important as we look at reducing our emissions as a state. So I think 2 months ago, Councilmember Cabrera and the research team visited the Wilmington wastewater plant. We thought this was a very good visit just to see what activities that the city is actually doing. And this is just a little highlight of some of the ways that the city is trying to reduce greenhouse gases. So the Wilmington wastewater plant was built in 1953, and it serves customers within the city limits as well. But in 2008, under Mayor Baker's tenure, he had a proposal to reduce greenhouse gases by 20% by 2020. And I think this was one in municipal buildings, and this is one of the most notable projects that he did, to have a renewable energy biofuels facility, which is able to generate methane. And this methane is actually not, at the moment, we don't think that is actually being, from what we saw, we think that there's potential for it. Because it can actually generate more electricity than we actually can, that we're actually using right now. So this is just, the next slide is just a process of how the whole process goes. It's just the process starts by removing the large objects from the waste that actually comes from people's toilets, and then they call it pollution. And then it goes through 2 cleaning processes to take out the solids and the waste. The leftover sludge is stored for about a month to make methane, which powers the plant. but then they still have extra, there's still potential to make extra, only that there's not legislation allowing them to transfer the energy to the grid. So it can only it can only serve the plant. So that's one area that we think is a potential. And then finally, the clean water is dispensed to Delaware River after going through the salination process. So what is Wilmington energy opportunity? We think that the solar rooftop project is really, really important, that we look into it and see how we can be energy independent as a city. Another thing is sensitizing people on the use of electric vehicles and the fact that they can also qualify for rebates. Another thing that I also want to talk about is on community solar. I think there's potential even as a city to have community solar, where we can, if you think about it, once a community solar is built, the energy goes directly to the grid. And then we can have, and right now the law is that if you have a community solar, you have to have 15% of the subscribers to be low-income earners. So which means that eventually after signing up and becoming a subscriber, there's credits because solar energy is cheaper than what Delmarva is actually supplying. So this is something that we need to look into. Community solar. Microgrids is basically something that is out of the grid, so you can have just microgrids separate from the grid in case you just want to be energy independent. But also balcony solar, there's legislations happening on that to enforce balcony solar, especially for areas like Wilmington, where you can actually have a rooftop solar, so you can actually have your own power through a balcony solar. On the next slide, is just talking about next steps. What can Wilmington do? Now that we've learned about all that, what can we do as Wilmington? And so this is bought from some case studies that I've put at the last slide on energy efficiency and how to look at the building codes available. And we looked at, the research team was able to look at the 2024 IECC building codes. One of the areas that we found really efficient when you talk about energy efficiency is having buildings, and this is probably for new buildings being built, to be solar ready, where they eventually, if they want to have a solar panel, they could have it because they're solar ready. So preparing the roofs to become solar ready, and this could be incentivized through different programs that are actually happening in the city. There's also the Energize Delaware program, Delaware Sustainable Energy Utility program. So there is, and programs under DENREC. So these are opportunities that we need to look into. Storage ready buildings are whereby, for example, you could have a part in your garage where you could actually separate that to have battery storage. Because most buildings or most apartments don't even have a space for a battery storage. A battery storage would need a place that is cool. So if you actually have houses being built to be storage ready, that is also some ways that we can look into having energy efficient buildings. And also building envelope insulation, which means that houses can conserve heat and have through the envelope insulations. So, and this is also one of the levels that we think that we can also look into the Energize program too. Inflation Reduction Act funds, which we know that it was a federal fund, which might be ending, but there's still opportunities. I saw that there's still opportunities to access that. Some of the programs are ending by 2028. So there is opportunity to look into that if we actually decide to move forward with this. With these projects. So some of the case studies that we found in California, so they have, like in one of their legislations, they mandate that all homes should be solar ready. So this is a requirement for them, and this has reduced installation. This supports grid reliability and aligns with the net zero goals for the state. In New York City, they have a local law that encourages large buildings to integrate battery storage. In Philadelphia, so that in Philadelphia they have municipal building energy retrofits, and this is where the city has implemented comprehensive energy retrofits. And they have implemented over 400 public buildings to have the improvements of heating and ventilation, and AC. So they have created in a way that they've been able to reduce 8 to 10% of their city energy use through having all these retrofits. In Seattle, they have periodic assessments and upgrades of building systems, which has also made an average of energy savings of 10% annually. So there is actually states and cities that are actually implementing energy efficiency in buildings. I think it's possible in Wilmington. And at this point where we think that we might go through a situation of energy deficiency because of the data centers, because they're coming up. They're gonna come up. It's a new era, and I think we need to be energy efficient as Wilmington, energy independent as Wilmington. Thank you.
Thank you so much for this wonderful presentation. A lot of information shared, and I'm especially looking forward to working with you on some of the next steps as well too here in Wilmington. Before I ask my questions, I will open it up to any of the council members if you have any questions. WIT, and we could take the presentation down so I can see the screen. Is there any questions from council members? Councilwoman Wilhauler.
So thank you so much. That was a great presentation. I think this is a topic that a lot of people have questions about, and I really appreciated all the information you brought. I do have one question, which I still don't understand, which is I get that demand is going up, and there's limited supply, but isn't it a regulated market? Like, why does the price go up? Just because there's more demand. Like, why don't they just say, oh, no, you can only charge this much?
Okay, so from my information, the one that I know is that when we have an increase in demand for energy, for example, in the winter periods, and we have base loads like nuclear power plants, or we have natural gas or coal plants being asked to actually power, it increases the amount of, because they're expensive power. This is expensive. It's not like renewable energy. So if you're using solar, the price is very low. If you're using wind, the price is very low. But if the energy goes up, now all these power plants have to actually be opened. And now, obviously, the price will go up because these power plants are expensive to generate. So that's eventually affecting the price of electricity. Yeah, so that's like the capacity cost, which is the amount that you have to pay to make sure that you're having electricity in your home. So if then we have to pay these base power plants, the big power plants like coal, nuclear and natural gas to actually stay open throughout, then it's going to increase the price.
Okay, I have a follow-up question. Okay, Mr. Chair. So those power plants, like they get to charge you more?
Yes.
And like, why do they get to charge you more?
Because they're expensive to run. It's not like a solar plant, which is basically cheap to run.
Okay, I have one other question, which I know a lot of residents have, which is, why is the delivery charge so high? Like, what are you paying for with that delivery charge?
That's a Delmarva question. I really don't know about that. I'll be honest, I don't know much about that. Yeah.
Okay, well, thank you very much. Maybe we can, I don't know, look into that, because I know I get questions like that from, my own family, and then also from a lot of people on social media and, residents that they're just like, what is this delivery charge that all of a sudden is like half my bill? But I'm looking forward to, that.
I'm happy to look into that. Yeah.
I know you have done a tremendous amount of research, so I want to thank you for bringing us all this great information. Mm-hmm. And I'm looking forward to more. I think this is an issue that a lot of people care about, especially as they see their bills go up.
Mm-hmm.
So I have Ms. Kendra, our legislative director.
Hello. So I just wanted to kind of bring some to your question about Delmarva. So, and this is just based on their presentation to the Intergovernmental Committee, is some of the things that Shaleen mentioned about PJM is they have energy auctions. It's my understanding that they will purchase energy years in advance. So the prices are different because you have to remember that these are that the companies that generate the electricity, they are commercial market companies. So that's a part of why the costs differ year by year. One of the things that she mentioned, and the reason that Shaleen is doing the presentation to kind of keep you all updated on some of the policy issues going on, is there is quite a bit of concern about PJM right now because across the region, the energy costs have gone up. People experience some of the same issues with their bills increasing, and other states are asking the same question to the extent that Pennsylvania, the state of Pennsylvania, has had quite a bit of buzz about possibly withdrawing from PJM and also having some litigation related to how much they charge. So, from my understanding, is quite a few factors go into the actual cost that a customer would get. But that is a part of the reason that is so expensive is because of the line maintenance, all the things that go into it. And also some of the legislation that Shaleen mentioned about the Public Service Commission. Previously, the Public Service Commission didn't have a lot of discretion over approving rate increases. But with the new law that was passed, they have a little bit more room to look at what the expenses are and to make a determination of whether it's something that is excessive expense and use that as a basis to be able to calculate or give a fair judgment of what constitutes a fair grounds to have a rate increase, if that makes sense. So they're based on the legislation that the General Assembly has put into place. Hopefully, there may be a bit more authority on the Public Service Commission to be able to look at the rate increases and give a more in-depth look at whether they're justified or not.
Thank you for that, Chief of Staff Simmons.
I was just going to make a comment, just but Kendra already had answered it in relations to a previous presentation that Delmarva did for us back in February. But just on a side note, I want to say thank you so much, Shaleen. You did a great job. I know all the work that was put into it, a lot of long hours. So kudos to you for a great presentation.
Thank you.
If there's no other questions, I have some questions. For the solar rooftop hotspots, and seeing some of these on the map on North Market Street in the first district, I know one of the areas, and again, full disclosure, I'm the board president of the PAL Police Athletic League of Wilmington. We have looked at solar at that building. I see we've been identified as one of the areas that would best suit that. I wonder if there's any additional data on the fact that like our HVAC and everything is on the top of our building, so we wouldn't have any additional room for solar. Do you know if that was taken into account with any of this study, or this was just based on heat mapping of the city of Wilmington based off different hotspots of the buildings?
So the NASA team actually came to our office, and we asked them, do you see the cooling systems on the roof? And they actually didn't take account of that. Actually, they only so they used Landsat, which was just checking on the heat spots of Wilmington.
Okay, because I know some of these buildings in the PAL's only 24 years old. The way they built these buildings in the past and decades prior to that may not be conducive to solar, but going forward, and greening or zoning codes, right? Could be a way that we could address this, especially with new development that's coming into the city. And I really love the especially for the balcony solar as well too. And seeing what we have to do to address that as well. I did have one other question. I mentioned the balcony solar. I forget what page. Oh, the data center. So, with what's going on there, I've been following what's going on Newcastle County, in Newcastle County, Delaware City data center. One of my biggest concerns is the data center that's being proposed down there will 100% create more environmental problems, especially with the waterways down there for the individuals who live in surrounding communities. There could be there could be health consequences as well too. But then also data centers produce a lot of waste. They use a ton of water to cool themselves and pull a lot of electricity. With us already feeling like first few months on council, got hit with a higher Delmarva bill. Then I hear that PJM wants to do a rate increase in June, and then they want to do another one. Have you seen any other places that have put stipulations in place that has stopped this using policy? I know you have the courts has pulled some permits and everything, but have you seen any policy solutions to addressing?
On the data center or PJM rate increase?
Well, on PJM or its
Yes.
equivalent other places raising the price due to the data centers coming in.
I haven't really looked on that, but so the problem with so PJM is like a regulator. They just have they get in the generators come to them and they're able to disperse. They're like a traffic controller, right? So they can from my knowledge, I'm not sure that even suing PJM would make any sense, especially for Delaware. In my perspective, because if we look at how much we've even taken, how much we're generating towards PJM is 40%. We're getting 60% from every other state that is in PJM. I think that as much as we want to really control the way that PJM operates in terms of the prices, we also need to also be able to be independent and supply more. For example, we have PA, which is, they can decide, you know what, we want to leave PJM. And they could leave if they want to, because they are the ones who are taking more energy to PJM. So they're asking, why are we also having to pay the same price? Why are you increasing prices for us? And that's why they're threatening to actually leave. So I think having the fact that Delaware is in a state of, at this state that we are really disadvantaged, to be honest. And that's why I think we need to really look at other sources of energy so we can be independent.
Thank you. Ms. Kendra, you put your hand back up?
Yes, so the Public Service Commission is also discussing a large load tariff for data centers to kind of prevent that passing on the cost to residential consumers and smaller users as well. So that's something that we are still following to see how that plays out.
Thank you for that.
And also on the fact of bring your own energy. So they might be asked to also bring their own energy as opposed to using the energy that is coming from the grid to control the rate increases as well.
Thank you. I am going to go to members of the public now. Again, you have 3 minutes, and please direct all comments towards me. If Mr. Victor Cushman, you have 3 minutes.
Thank you. Just a couple of quick comments. I hope the council will do their best to take this great summary and the work that the research team is doing and turn it into actionable policy. And by that, let me mention 4 things. There is a discount available to people who charge their EVs and do that in off hours to use off-hour power, which generally goes to waste. But Delmarva Power and PJM have made it so difficult and the cost so high that the payback is over 40 years. You have to put in a new meter, which frequently leads to putting in a new service to your residents. In other states, they have a metering ring, which does this for about $500 instead of $4,500, and can be done in about 15 minutes. So there's a policy impact that could be done in the city that could sway the direction or at least threaten them to move that way. On microgrid and residential solar, after last year's bills, I looked at doing that on my house. I can provide 80% of my need. I've been trying to navigate Delmarva, DENREC, the state, the city of Wilmington, to get my design and all of the pieces validated so that I could just buy the equipment this year while it was a tax deduction before the end of the year. It's almost impossible. And in California, they have a single point of contact. You can go into one office and there are people who will give you the forms, show you what you have to fill out, show you where you have to get them sent, and literally in an afternoon you can get your work approved. The only way to do that in Delaware is to pay one of these solar installation firms, and their markup is over 40% of what the cost of materials, people, and the actual equipment is. It's just a highway robbery. And that extends to the Energize program as far as I'm concerned. They are just another form of that. The last thing is, I hope we'll encourage heat recovery of industrial buildings. They do that over at the DuPont Experimental Station, but we should do it on all buildings. A ton of heat is wasted. Heat is energy. And if simple heat recovery was put into a lot of industrial things, that would reduce a lot of demand. Those are my comments. I look forward to seeing practical changes here in the city.
Thank you, Mr. Kirschman. And just to get an opportunity to connect with you, I would love to connect. So if you can take my email, my phone number is 302-650-5191. And my email is cjowens, at wilmingtonde.gov. Again, my phone number is 302-650-5191. And my email is cjowens at wilmingtonde.gov. I would love to connect with you. Is there any other comments from the public? Kendra, Miss Kendra?
Yes, so sorry, not to prolong a meeting. I just wanted to say Shaleen really did a great job covering this topic. It is very expansive, but there are a few reasons I just wanted to highlight that she's doing this presentation. The first is that Wilmington is probably one of the most energy burdened places in the state. And so I know that it is very difficult for people to adopt things like solar when they live in a row home or something of that nature. But as she mentioned, there are things like community solar. Technology is really moving forward to be able to make an impact that is relevant to Wilmington when it comes to energy. I also wanted to emphasize that there will likely be new legislation coming out when the session opens related to energy, and probably quite a bit of it. So we, as the research team, will definitely stay on top of it, but we want to make sure that the council members are aware of where some of these things are coming from and have a sense of what types of things to expect in the next session regarding energy. And finally, just to say, we've also been looking at what has been done internally with the city. And in light of the state's climate action plan, and some of the goals that they have, the city is really performing well in terms of city facilities. A lot of the technology that is being used in other places is there. So there is quite a bit of capacity. I think I would just say that a lot of things like Shaleen mentioned that there are biofuel equipment with the city, which is something that's used to process waste. but they are not able to put their additional energy back into the grid. So it's not really a question of technology in certain instances as much as the policies that are in place in the state. So I just wanted to emphasize that is that, and as the person who did, Mr. Cushman mentioned, some things are a matter of policy and the processes that we have in place, not necessarily the city of Wilmington or even the state lacking the capacity to be more impactful when it comes to energy. So I just wanted to highlight that for the council members. We will continue to stay on top of this issue, and we definitely welcome if you hear of anything from your constituents or you have something that you think might be helpful to explore. We're definitely here to go deeper and give you more analysis on that because it is a very expansive topic. Thank you.
Thank you so much. Thank you so much for this amazing presentation. And with no other public comment and questions from council members, I will entertain a motion to adjourn.
So moved.
Is there a second? Second. All those in favor say aye.
Aye.
Aye. All those against say nay. Meeting is adjourned. Thank you so much, everyone.